Sweden's government has in place a high-risk, low-restriction approach to COVID-19 that many believe could easily backfire.
The restaurants are pretty normal. There's people eating outside. The schools are open.
Why they're running all together, I don't understand.
Authorities believe that heavy restrictions are both difficult to maintain and hard to recover from, so having the country operating somewhat normally is the ongoing strategy. Anders Tegnell, the country's chief epidemiologist and leader of the government's pandemic response, insists that herd immunity isn't the goal. That's a strategy that's been globally criticised for the potential to cause large-scale death.
This long-term thing on the low scale that we do in Sweden is much more sustainable.
Instead, his is a strategy of mitigation, allowing the virus to slowly spread without inundating hospitals and healthcare facilities.
It has worked quite well. I mean, we still have free intensive care places in Sweden. We can definitely take care of more people if more people should turn up.
That's not to say Sweden is restriction-free.
It is a myth that life goes on as normal in Sweden.
There are guidelines recommending that people wash their hands, social distance, and work from home if they can.
I think they're having the right decisions, like having schools open and so on. As long as you wash your hands and keep a distance, it feels like if you're not in a risk zone, then you should be out.
Gatherings of more than 50 people are banned, and universities have been told to take teaching online.
This is something unique, I think, in societies. Of course, we don't have the scientific evidence to back these things up.
But these are all relatively mild measures in a European context.
Sweden is experiencing a rising death toll. Meanwhile, its neighbor Denmark is set to ease some of its lockdown restrictions because of a drop in the number of infections and deaths.
Its neighbours, Denmark and Norway, have a markedly different response to the pandemic. They quickly shut their borders, schools and industry to slow the spread of the virus. And the data is showing that it's worked. Sweden's number of deaths compared to its Nordic neighbours is colossal. And there is internal opposition to the approach.
I'm a scientist. I don't trust authorities. I trust data.
In March, over 2,000 doctors signed a petition condemning Sweden's response to the coronavirus and appealed for more containment measures to be put in place. The grim result of Sweden's resistance to stringent measures is its impact on the elderly and the vulnerable.
The measures that have already been taken are to protect the elderly, and if we see that this is not effective enough, then we of course will take the next measures.
Anger is intensifying in the country at the lack of masks or sanitizers in care homes, where there have been the worst outbreaks of the virus.
The high numbers of infected people at the homes for elderly care is challenge.
Tegnell admitted the situation in nursing homes was a big problem area, and that the number of deaths reported from them was likely to be an underestimate, as many of the elderly who died were not being tested.
What has not worked very well is our aim to protect the elderly. Unfortunately, we had quite a lot of people in elderly homes that got infected and died.
For now, Swedes seem to be going about their daily routines, and time will tell whether this high-stakes experiment will pay off for the wealthy Scandinavian nation.